Um, we are going to have our next presenters start. It is my privilege to introduce you Charles Stillings. He is a seasoned healthcare executive with 14 years of experience in healthcare operations, known for delivering strategic direction that aligns operational goals with financial targets and fostering collaborative, community-centered approaches. Charles holds an Executive Master's of Healthcare Administration and is currently the System Associate Vice President, Environmental Services and Lineage Management for Baptist Health. Additionally, Heather Napier is the Executive Director of Quality and Outcomes at Baptist Health Corbin. She is certified as a professional in healthcare quality, healthcare accreditation certified professional, and has served in clinical advisory work group for the American Association of Critical Care Nurses and DNV Healthcare Advisory Board Accreditation Committee, as well as E&M PQM Primary Prevention Work Group as Measures Recommendation Member. Prior to transitioning to her current role in quality, she had worked 10 years within the critical care service line, both at the bedside and as management, focusing on implementation of best practices to improve patient care. At this time, I will have Charles and or Heather share their screen, and we can dig further into environment of care.
Awesome. Thank you so much for that wonderful introduction.
Absolutely.
Setting up my screens and everything. I have too many. I have three screens. Well, thank you for having me here today. It sounds like it's a tough act to follow. I'm just watching the chat getting fired off from the first presentation, and let's see if we can keep up the momentum. So, like she said, my name is Charlie Stillings, the System Associate Vice President for Environmental Services and Linen Management. I've been with the Baptist organization for about 3 years, and before that, I worked with the Tri-Health organization in the same role, but a little bit more expanded capacity. So I'm excited here today to share with you some of the progress and outcomes that we made with the Association of Healthcare Environment. It's a program that's through American Hospital Association, which I'll go in depth about today, and how it directly supports infection prevention efforts across our system. So Heather, who's kind of my partner in crime or my associate and colleague, has been leading the effort, a tremendous effort of training individuals for their chest certification, which we'll talk about. So there's a lot of good things happening here at Baptist. Heather, I don't know if you want to add anything before I start kicking it off, but
No, I've nothing to add. Thank you. Thank you for having us.
awesome. So we'll jump right into it. And then let me know if you can or cannot see my screen, because it's definitely on my end and it's always user error. So just a little bit of a personal journey before I get into it. AHE or HE, yeah, I haven't heard of it before I started working in the Kentucky market, right? I've always kind of wondered what kind of associations or certifications are available for someone that's an environmental service professional. So when I started working in the Baptist market, specifically with the Louisville Hospital, I found out something called a chest certification, right? And CSCT. As I did some more digging to find out what it was something that I knew that we needed to partner with, especially in our current environment where it's highly competitive and there's a lot of different contracting groups. We need something that we could partner with to help really move the needle with our outcomes. So we partnered with the Association for Healthcare Environment, which is the nation's leading body for environmental services professionals, to bring standardized certified training to our EVS staff. The goal behind this was really to standardize our approach and establish the why we do certain things in our environment, as well as building confidence and reducing turnover. So as I go into the benefits of the program, I think you're going to see a lot of links to why this makes a smart decision for a large or small organization to partner with such an amazing group. So briefly about the organization, if you haven't heard about it before, like I said, for me, it was introduced 3 years ago, but the Association for Healthcare Environment is a professional membership group of the American Hospital Association. It's the leading organization for professionals dedicated to maintaining a safe, efficient, and contaminant-free healthcare environment. Serving over 2,300 members across the nation, they provide top-tier tools, education, training to elevate the EVS field, and shape the future workforce. Really, its mission is putting the science and the practice together, empowering members to create sustained, clean, and healing environment that supports patient safety and operational excellence. And it's if you've ever been to the website, which I strongly encourage you to go to, there's a lot of resources. There's a best practice guide that we went on there that really helps shape some of the policies that we use today. It's our one-stop shop, or our first stop, I should say, if you're looking for resources, along with like CDC and other government websites. But absolutely love it. So there are three main certifications, or their programs, that we focus on here at Baptist. One is the I mentioned earlier CHESS, which stands for Certified Healthcare Environmental Service Technician. It's nationally recognized and designed to help equip our environmental service professionals with the skills and knowledge necessary to support infection prevention and deliver high, safe, quality care. Now, when I conduct these classes, because I do throughout the system, the way that I explain it is that we're attaching the science and the why behind what we do and why it's so important. And when you have a structured curriculum where participants can learn the critical role of AVS plays in infection prevention and control, you get a higher level of confidence and a better sense of how they use best practices for cleaning occupied patient rooms, discharge, transfer areas, isolation, specialty care, you name it. How do they prioritize tasks, communicate with our nursing team, which we'll talk about later, and just some of the foundational items that we've never really established why it's so important. Right. Other certifications that we focus on at Baptist is the Certified Surgical Cleaning Technician. Now, we've had this program throughout the facilities, but I'm excited to announce that our first system training, which we have about 15 people signed up, is happening in Lexington in the next couple of weeks. The way that we do these type of trainings is that we bring everyone together in a safe space where they can focus on themselves and learn about the special practices used for surgical cleaning, and really just disconnect them from the operation so they can really just focus on themselves. Well, this program, with OR being such a critical space, specializes in training the responsibilities of cleaning and disinfecting the surgical suites. This will equip their leaders with the understanding of why there's such a high standard in cleaning these areas, emphasizing infection control, as well talking about compliance, like HIPAA and cross-contamination prevention. Even though every space in the hospital is really important, there is none other more important than the surgical spaces for people that are in endo, cath lab, OR, labor and delivery, and making sure that they're confident and competent on the needs to support the surgical safety and protect our patient outcomes. The last one, which is site dependent, we still do it, but we get a high demand on our chest program and our surgical program, but we do have the certification of non-acute care cleaning, which really focuses on our clinical spaces, but also some safety and best practices. Besides our clinical and areas that are kind of shut down at night and a little bit easier to focus on, but it also talks about supply handling, chemical usage, proper laming, a lot of the safety techniques used, but also construction zone cleaning. Also, how do we handle specialty items like behavioral units, long-term care facilities? It's really closing the gap of some things that haven't been touched on too much or talked about in these settings. But when you put all three of those certifications together, you're really encompassing the entire EVS world and specializing them on making sure that they're safe, they provide excellent service, efficient, and then provide quality outcomes. So that's the program overview. I'll pause a little bit for questions. Maybe take a drink because my mouth is a little bit dry because that was a wordful or mouthful. But any questions at all? All right. So why do we do it? Like if we're looking at the data and what it says across the board now, before we took on this big venture, I will say that we put our toe in the water and we're trying to figure out if this is the direction that we wanted to go. Louisville was the first, like I mentioned earlier, hospital to really start investing into giving environmental service team members the CHESS certification. And we did see some positive results with retention in that time span. We only lost one in the organization. So when we look at the data that AHE has provided, we see our turnover rates drop from 7.5%. Now, I don't know how often you hear it, but the environmental service team has a high turnover rate, right? And a lot of the times we're trying to put people in the right places, but there's not enough individuals. But so the reason why we wanted to shift this way was to really focus more on retention versus just constantly hiring somebody in there and just rotating new. And by showing them that we will invest in our team speaks volumes, but also puts pride behind what they do, retention, and improves performance. So the numbers they provided, it's a 7.5% average drop, and you're going to see some numbers here with Baptist that kind of links everything together, that kind of puts some science behind it. From an HCAPS perspective, from the data provided by HE, we're seeing improvements with HCAPS across the board. And again, it's confidence in understanding the why we have to have such important interactions. Most of the time, it's more of an emphasis on the patient experience than it is cleaning, even though cleaning is an important aspect of it. But making the patient feel comfortable during the healing journey is also an important step. And as you can see from the national data they've collected, just by the confidence and understanding that with our team members, is a 10% improvement of HCAP scores across the country. So we really spent a lot of time, and if you take the CHEST certification program, they have a whole module dedicated to patient experience. It helps them understand why we have to use certain type of interactions or scriptings or acronyms if you use AIDED or GREAT, why it's so important to reduce some of that anxiety. And like I said, just establishing the why it's so important. And then, of course, infection rates. The fact of knowing how certain disinfectants interact with certain pathogens and certain touch points have to be done with certain dwell times, just connecting the science behind it is it's monumental in a sense that they understand why it's so important. Instead of just skipping the step and just saying, I don't want to do this because it's extra work, they understand that there's risk involved when you're not doing it. And when we connect it all full circle, this is where we see a huge decrease in HAIs. And that's what you see on the screen here is just a 50% reduction with it. Now, I will say, teaching the CHEST class, and this is where I value Heather the most, some of those pathogens and words that I have to pronounce, I don't even think I'm close half the time, but really I'm just kind of getting used to all the names, acronyms. So infection prevention, when we do these classes, typically partners with us so they can help us in the first module, which really focuses on infection prevention and certain pathogens. And then the rest of it is about best practices in EVS. So that's where the partnership connects. But I will say, I've murdered a lot of words trying to get through some of those really, really long pathogens. Now, the other part is building confidence, right? Just getting out there and connecting with the nursing team, with leaders, physicians, and understanding what they can and can't say. When they do graduate the class, you see a pen that's on their badge. It's a CHEST certification badge. I don't have mine with me. I think mine's on my badge in my car. But they get one when they graduate, and then they feel the confidence that they know why things need to happen a certain way. And we do see an improvement, and we see people adding it even from the lead level or supervisor level, adding it on their email tags because there is a high level of pride with it and that they have accomplished something. The class itself is not easy, right? It's 3 days of just book studying. It's going over it, quizzes, going over best practice exercises. So it's a lot of mental capacity that's needed to do it. And then they have a final exam the last day before they can be awarded the CHEST certification. But it is a long, daunting task, and we want to congratulate them. And in turn, that's where the increased frequencies come to play and the confidence becomes to build. So that's the data that AHE has provided. And honestly, what you're going to see from a Baptist perspective is that there's a correlation between the two, and which we're excited to announce. But before I get into the Baptist data, I'm not sure if anyone had any questions about AHE, but I'll pause one moment while I'm flipping some slides if someone has questions. All right. So the Baptist journey was a long one. So when I first started here 3 years ago, Baptist was separated, different contracting groups. I'm sure we know the names throughout the different systems, and decided to take everything in-house, right? To make kind of one program, one Baptist Health organization for EVS. And to get there, we needed something that's foundational and standard, especially in cleaning practices, how we approach certain surgical suites, right? We just needed something standardized that we can work off our training with. So when we look at the data from a 2021 standpoint, we're looking at some of these are our turnover rates that we're sharing here. We're looking at a 57.0 turnover rate, which is pretty high. It actually was a little bit higher the following year, but we're going to share this one. 57 rates for our overall turnover rate. That's anyone that's been beyond with us for 12 years. And if anyone asks, it does not include anyone that's been transferred to a different department. These are people that have left the organization and have gone somewhere else. So as you can see, it's widespread across the board. Those are the individuals we want to keep because we know that anyone beyond the first year, we can at least get them dedicated into the organization and get them to move up. So from a new hires perspective, it's a little bit more higher. And I'm sure some of these numbers are familiar with your organization, but we are at 117%, which is, at some locations 156. You see there with Hardin, all the way down to Corbin, which is 56.5. And if you look at the national trending data in this time period, we're pretty much in line with what we're seeing as a trend, right? We're probably a little bit lower in terms of overall. We're definitely higher in terms of turnover rate. The Kentucky market in this time period is very competitive, as we know that other companies with same qualifications are entering our space. And so for Baptist or any health organization, we have to pivot and change to really survive in this adapting environment. So kind of the bullet point reasons, what we just went over is, we've had a pilot that's going on since 2020, 2021 with 41 team members receiving their chest certifications, being really our stepping stone to where we need to go. From a post no contractor, right? There's no formal cleaning process because we no longer have a contracting group throughout our systems, no formal quality assessments to really measure the cleanliness of our organization, lack of partnership between nursing between nursing without engagement or confidence between the two. It's like we're in the hospital, but no one knows that we're there because we're not stepping up and speaking out. And then our costs were out of control, right? Because every time, these numbers are just provided internally, but we calculate to replace someone around 16,000 per person, and that the head count at this time period is close to $5.3 million. So that's a lot of cost avoidance. That's a lot of money that, could be redirected for other things. And I know everyone's got a list of their own, but really just focusing on keeping our team members within the organization and having them, my goal is have them promote within, either to stay within the EVS department, which we'd absolutely love, or maybe a future RN or someone that's and wants to be an infection preventionist. Really, it's a hiring base for any department within the organization. And that's kind of how I view it. So the longer we keep them in the department, the better we can self-staff through ourselves. So when we look at today, right? So we had, and knowing the data that was provided through the hospitals and and kind of the way that we need to shift and change, we started partnering not with just AHE, but with other organizations that kind of help fund these programs, right? I saw something in the chat talking about cost. But one thing that is a resource that not a lot of people tap into, which we did a lot, and the Baptist Health Foundation funded the majority, if not all of it, in terms of their books, the class locations, I think meals that were provided, hotels to have people come visit to get leaders T-CSCT or T-CSCT certified. Great, it was a great opportunity. It's something to share, and they jumped right on it. And the foundation was more than willing to. And this actually was shared with me from another organization that had great success with this, where they tapped into their own foundation and found funding through there. And it really doesn't, what we asked for, and I'll share this amount because it came up in the chat. We asked for 20,000 over 2 years or 3 years, and to hit a certain goal. And we got a lot of classes out of the way, and we're still doing a lot of classes today. So with that partnership with the Baptist Health Foundation and AHE, we started conducting system-wide and local chest training sessions. Corbin has Heather does a phenomenal job leading them down in Corbin. We do it in Lexington with me and a group of individuals, and infection prevention joins. Louisville, we've done some in Paducah, and the turnout has been phenomenal. As you can see, we have 135. In the next couple of weeks, it should be breaking 150, but our wait list is even longer for people that want to get their certification, either chest or CSCT. We also hand out books and material for sites that want to conduct their own, which we just placed another order today for another 10 books for a class that will be done in another location. So there is a very high demand, which, you're going to see some numbers here in a little bit, is correlating some great results. And then graduation rate's 95%. We focus a lot on reviewing the material with them and making sure that they're comfortable. We tell them to study, and that it's going to be, the exam, it's going to be, a lot of the questions that they have, and, attaching the why to it. And, being 3 days in there, hearing different things, we keep telling them, make sure to study. But they're doing a fantastic job with such a high graduation rate, with so many coming through. They absolutely love it. So where we are today, with our turnover rates from where we started, we talked about a little bit ago at FY 2021, but now with our overall rate, we're at 32.9%. As you can see, it's a ski hill down. Really just focusing on our investing, our education on our existing team members. We do have some, policies saying that you have to be with the organization within 6 months before you can take the certification. That's just that kind of help filter out some of those, the high demand, and letting people that have been here kind of go first. But I mean, it's working out really great, because even though we have a waiting list, every time I visit a location, everyone's asking when the next one's coming, and we have plenty scheduled, and we just don't have enough of them. And so it's really exciting to hear that, and hearing the impact across the system of people wanting to receive these certifications to be more confident and provide better outcomes. From the new hire standpoint, we cut our turnover rate by half, right? And a lot of this is just letting them know, like, hey, you might not be eligible today, but there's something down the road for you. And so when people see that there's a pathway, especially in education or, building confidence, people will hold out for it, right? Our new hire turnover rate is, if I could show you the same graph I had earlier, which I can't, you'll see that a lot of those locations have dropped tremendously. And some of our locations are fully staffed for the first time since I've been here. So it's really exciting, even from a new hire perspective, to see that they're interested in it. We do let them know about it in the orientation period, to say, hey, these are options for you down the road. If you stick with us, please stick with us, because we're gonna take care of you. And it's working out really, really well. And so this next slide here, I put this in here just to show some of our graduating class. So these are from all over the system. I don't have them all. I'm actually missing quite a few, but if I were to stick them all on here, I'd run out of space with everything. Please ignore my hair in several of these pictures, because it was windy some days. That's what I'm going to say. I'm going to say it was windy. But see how excited they are? You can see their green chest pins. We have the stuff on the backboard. It's just, these are phenomenal groups. And the great thing about it, besides just building that confidence level with them and just teaching them the why, is that they create relationships with each other and relationships with others in the organization that kind of share their trials and tribulations of working in healthcare. And a lot of them still talk today, talking to some of these supervisors and managers who do also take the class. They communicate, and now they're friends, and they lean on each other. So that's kind of the importance, if you do decide to go on this road. Having them have a separate space where they can talk to each other and get separated from the operation really helps them invest in each other and invest into their own education. And like I said, it's been such a journey. It's been great. So feedback with the program, because we always send out a feedback survey afterwards, because we want to know, it's exactly kind of what we've been saying, right? I feel more confident in my training. They understand the science and why that we do things, right? The training has greatly improved at Baptist, right? People are relating this to not just the orientation training, but now as ongoing training, which they feel more confident with it. The other thing is it gives them a break from the normal routine, right? It's just, when they come to work, it's kind of the same, it's dynamic, but it's a sense you still have your, 10 or 15 rooms that you have to do today, sometimes 20. It gives them a break from their normacy to do, something different and invest in themselves. And then the last one is understanding why we need to clean and disinfect, the differences between the two, the importance of touch points, the importance of achieving that dwell time, the different harmful pathogens, why we need to change cleaners. It's really just connecting all that so that they know why they have to do it, instead of they're just being told to do it, which I think is the best investment of them all. So with that being said, I'm going to pivot over to Heather, who's going to talk about the nursing collaboration side of things.
Thank you, Charlie. So one thing that coming from the nursing side and working with our environmental service team, for us here at Corbin, we recognize there's kind of a gap. So really looking at our processes for nursing. So things like as nurses, we're quickly trying to get patients in and out. So I'm thinking, oh, I'm being helpful if I go ahead and wipe this wet bed off and get my sheets on. So talking to the nursing staff and explaining those dwell times, because reality is that's not something we teach. We teach pieces of infection prevention, but not to the cleaning level that our environmental service and technicians get. So what I try to do with every training is walk through some processes that our EVS techs are seeing our nursing staff or our other clinicians do to say, can they assist us with not overfilling bags so it's safer for us to get those bags in and out of linen? Or, can you talk to the nurses about why we clean in this route or why the bed's wet and we don't want you to dry it off to ensure that dwell time. So really working on opportunities for the nursing side to see the importance of that EVS staff's cleaning routine and expectations as well has been really beneficial for us.
All right. Thank you, Heather, for that. I see some questions coming through the chat, and I'll answer those in a second. So, with the collaboration, right, and the connection with either the department or the hospital, or just in general, just building relationships where they matter, you can see that the cost to replace individuals is significant, right? When you talk about cost avoidance, and I know we talk soft dollars, but it's still a cost no matter where it is in terms of hiring and training and lost productivity and overtime increases and premium pay increases. List goes on, we all know it. But with these programs, we're getting a reduction of headcount turnovers, and this is where we get the total cost avoidance of about 2.4 million, or about 145 individuals that decide to stay with the organization. Now, I saw someone ask in the chat, is there some type of productivity bonus? And somebody must have leaked the agenda, but let's talk about that a little bit. So, how do we put some of these savings into practice, right? And you see the dollars, you saw that in 2020 or 2021, we were losing $5.3 million, and then the ongoing cost of just constantly hiring and then everything else that comes with it. We put together an EVS productivity bonus program that really says thank you to the EVS team members for investing in themselves and applying their education, right? And we put some guardrails with it to make sure that the training stays what they're at, but also to continue recertification. But this is kind of what we put together, and it's approved and we use it today. So with that money, which like I said, if you can figure out the head count, please, you can use the number that I have because it's pretty close to where everyone would be paying per head. That's 16,000. If you look at it, if you do $1 per hour per certificate, we do one certification right now. We're going to hopefully push for more soon. It helps move up their hourly pay, but also, because nowadays it's so competitive in the spaces where you're looking at like Amazon and other companies that are building factories all around us. But this is a way where they can invest in themselves and they can see it being applied to a dollar amount. So we do it, we limit it at one per hour. Some locations vary because some do more, right? And some do less based on where you live, but it helps motivate them and also helps them keep it up to date, right? So part of that issue is, you got your certification, great. We want to reward you, but we also want you to use that knowledge, right? And not try to deviate away or keep it up to date, do ongoing training. So after they receive that dollar an hour, they have to, stay up to date. They have to achieve the certification, obviously, and remain in good standing with the organization as a way to get some of our investment back. So they love seeing it. They love seeing how immediately after they graduate, it's applied to it. Besides feeling confident about what they do, it's just putting something a little bit extra in their pocket, especially in an environment that's very competitive. And then when you see these numbers, really, it's kind of a drop in the bucket if you talk about our goal, right? So we took some of those numbers a little bit ago, the 7.5% turnover rate that you saw, and set a goal for about 50% of our total FTE. And to achieve that, over that time period, it's $865,000 every year. And you saw the numbers for cost avoidance, right? And those were more like millions. And we're talking like a smaller amount, right? Now, that's how in those conversations, if you partner with the Baptist or if your foundation locally and you connect with your executive leaders and you talk about, hey, instead of just having a conversation about moving the minimum wage up for each organization, how do we have them achieve something and invest in themselves and in return gain something back for our community and our healthcare? And this is the best way to do it. And this is how we got all of our facilities to agree to use this program. So when you think of the long-term picture, because, what if we get 100%? Even when you're looking at 100% at a system rate, you're still only taking 50% of that money that I was showing you as cost avoidance. But the other buckets are endless. I mean, if you think about what I haven't shown you today, the overtime use, how contractors coming in, temp labor service. I mean, this is just focusing on their pay and retention. So if you put that all together, you're talking a very large amount. So I guess my big challenge is, a lot of what I hear from other organizations that have called me is, how do you fund this? The funding is already in your budget. It's just how do you prepare the data to the team, to the executive team to understand where you need to pull the money from, and then also partnering with your local foundations to see how we get the cost of books covered and things like that. I mean, most foundations, when you talk about helping and training that has excellent patient outcomes, which you saw today, it's pretty much a no-brainer. I mean, when I presented it to the foundation, it was pretty much approved. So that would be my encouragement. And again, I'm sure that my contact information will come out. And if you want me to talk to EVS leaders about their own program, I'd be happy to speak with them and talk strategies. But with that said, that was my last slide. So if anyone has questions or comments, or I haven't seen the chat, so if there's questions in the chat that people want me to answer, if someone can read them for me, I could definitely answer those.
It looks like we did have a couple of additional questions. One is this course appropriate for long-term care?
Yes. So if you do the CNACC one, the non-acute, there is a module for long-term care.
All right. Hang on one second. Is there a shortened version of this curriculum required for all new hire healthcare staff, including nurses, techs, etc.?
So there isn't one from a nursing perspective. We did create a version of it. We call it the Baptist Way to Clean for our EVS team members, and we share those policies, infection prevention, specifically even the Louisville team and others throughout the organization. I know there's all, not just even Louisville, but we wrote up policies that kind of help with the orientation period of just the why we need to clean things a certain way, and then we share that with everyone in our organization, and then this comes in as a program to really enhance their knowledge base. So I hope that answers it, but they use our initial policies to get started. But I mean, a lot of that best practice stuff came from a lot of what this program itself and some CDC guidelines and EORN standards. So
To take the chest certification, is this only offered in person?
That one, if it's chess, yes, I believe, because so I host it, Heather has hosted them, and then we have to do the proctoring in person. We've been asking questions if online could be possible. I haven't done it per se, so I don't know if there's an online version available, but we do it all in person, just to have the whole environment of, connecting with people and having discussion.
Do you do any remediation or redos for the 5% who do not pass?
Yes. So we have a lot of individuals that are T-CSCT certified. Though T-CSCT is the only individuals that can conduct the chest certifications. So what we do for the 5% is that if they don't pass, we get them with someone that's T-CSCT certified to re-go over the exam with them and teach them what's going on. And honestly, some of that is, it's getting overwhelmed, people getting flustered, and they miss one or two questions, right? And then it's just going back and redoing it with them. So we do have a process for retesting.
And then one last question around availability in other languages or individuals with decreased literacy. Are there processes in place or tools for that?
So And that's as I was thinking about that too with the graduation rate. So we do have individuals that English is a second language, and we're working through barriers where we partner with organizations like the Kentucky Refugee Ministry to help break those barriers down and be a part of it. There's some software that is available that does active translating between, if you speak Swahili, they can go back and forth and it actively translates. We actually were just looking at this and adopting it into training. So hopefully we have a big announcement with that soon. But yeah, if they're partnered with a certain organization like that, they can have interpreters available. Now, most individuals, part of the journey is that individuals that have language barriers, we also go through a whole English as a second language course. Louisville actually had one, Floyd's doing one, and so is Lexington, where we can partner with local community colleges. And Kentucky and Indiana have great funding programs where 75% of that can be funded. Louisville had the first graduating class, I think, a couple months ago, maybe 6 months ago, and then Floyd is working with Indiana Community College to do that. So I would encourage you that it's called the Trains Fund, and a lot of states seem to have it, especially in these type of situations. So if you do have individuals that English is not a second language, encourage the EVS leader or other HR was the one actually that got me connected to reach out, and there's usually money available.
Another question. So one person asked, is it possible to send one member of your EVS team, a manager, or to in-person training, and they be able to come back to the facility and train our other staff?
So we do have people, managers and assistant directors that go and get their chess certification, right? So they can provide that knowledge onto them. We do it as an orientation, right? So we have our own leadership orientation, and then we send them to do chess certification. That's the only exclusion to the whole 6 month kind of waiting period, is that we want to get them trained up as much as possible. And then they feel more confident, and then they come back to the facility and start using the same verbiage. So they can train on those practices. They can't, however, get anyone chess certified. So if, for example, if I went to chess and I got a chess certification, I can't go to the frontline staff and give them a chess certification. I would have to go get my T-chest, which if you didn't know, there is a scholarship that's going on right now where you can get your T-chest in Kentucky if you apply for it. And then you go to those 3-day courses to get your T-chest, and then you can go back to your organization and get everyone chess certified.
All right, great. Thank you. Any other questions?
Julia, if I may add,
Yes,
I'll
absolutely.
tell a little story. We had a young lady who worked for our environmental service team who recently completed her chess training and certification. She came back a little time later and said she felt like this gave her the motivation to go back to school and get her GED, which she did recently complete. And then she has now enrolled in our CNA program and is looking to move on to becoming a nurse. So this has given her motivation far beyond what she thought she was capable of. And so it's been a great thing for her and many of our staff.
That's fantastic. I had the opportunity to sit through one of the chess trainings as well, as some of the team members with KYIP. And it really is an excellent educational series to sit through. And I can see how it would be very, very, very beneficial for our staff. There's a question about where is the info for the scholarship for T-Chest? Do you know?
I have it. So Julie, I'll send you the email, and then if you want to distribute that to the team or whoever
Sure.
asked, the
Uh-huh.
scholarship closes, I believe, third week in May. So you can apply. And then it basically will include all the training, the funding for the training for T-Chest, and then a year membership in HE. Oh,
Great.
someone dropped the link in.
I think that I had tried to get with Deb Campbell. So it looks like Deb Campbell with the Kentucky Hospital Association put the link in there and I believe that's got the scholarship information. Isn't that right, Charles?
Yep, no, definitely. And if it wasn't for KHA and just having these scholarship opportunities, I don't think we'd have as strong of a foothold with the knowledge that we do today. Because those scholarships, honestly, every time they pop up in our organization, we're using it. So I would encourage everyone to use it.
Yeah. There was another question. Is the scholarship eligible for someone from Georgia?
Uh, it, I think it's just focused in Kentucky. That I wouldn't be surprised if there's other
Hmm.
organizations out there that or associations out there that have it though. I mean, honestly, I mentioned in the beginning, I didn't know until I started looking, and then when you start looking, there's tons of resources out there, right? So I mean, the collaborative in there's usually collaborative associations in every state, so they're there. Or the Trains Fund that I mentioned a little bit ago, the foundation that we work with, we actually sent some people to get their T-chest during a period, so there's resources out there.
All right. Any other questions for Charles or Heather? I think I answered all the ones that were in the chat. Um, yes, so Deb, I think, pointed out that the scholarship is only for KHA members, but once you have the certification, you are T-chest certified or you are chest certified, and that is something you can take with you wherever you go. So if you do get it someplace else, it is yours to take. It's not a state specific uh training, I believe is what you're saying there, Deb. All right. Well, if there are no other questions, again, thank you very much for that fantastic presentation.